That's right. Good morning and welcome back to We Are Austin for a brand new Medicare Monday with Mackenzie. This is when we get insights on what Medicare benefits are available to people and how to navigate this sometimes complicated system, that's for sure. Mackenzie Anderson from Premier Medicare Solutions is here this morning to discuss the choices that you have if you are one of those who's still in the workforce at age 65 and older. Great conversation. Good morning to you, Mackenzie. Great to see you.
Good to see you again as well.
Well, this is a good conversation. I think we probably can agree something that is common these days is people are working a little bit later in life and you may not be retiring right at 65 or earlier.
Right.
All right, so if someone is still working at the age of 65, do they have to sign up for Medicare?
Yes and no.
Okay.
So with your employer coverage, you want to make sure that it's, well, I guess a good rule of thumb is if it covers more than 20 employees, it's seen as creditable, which means it meets the Medicare standard. So it covers just as much as Medicare. If it doesn't cover 20 employees, then most likely it's not creditable and you would have to sign up for Medicare. But with everything, just talk to HR and ask them if you should be signing up for Medicare while you have that.
That's good advice. So that's a great rule of thumb. Is there anything else people should kind of think about if they're deciding, do I stay with my employer health plan or should I enroll in Medicare? Anything else to think about there?
Yeah, you know, that is a...
Sure, there's a lot.
Yeah, there's a lot of different answers to that question. But, you know, if your coverage is high deductible paired with an HSA, health spending account, then all contributions that are made to that HSA from when you have Medicare could be taxed. So definitely don't want to sign up if you have that. Another one is, you know, if you have family or spouse that is covered by the insurance, then, and you know, they're younger, then a lot of people, what I see there is they will stay working until they can get them off or whatnot, because, you know, you'd have to find your spouse and children coverage through individual plans or through Obamacare. Which can be unaffordable. Yeah,
so many factors to think about there. So do you face any penalties if you delay your Medicare and you're still working and you have coverage? How does that work?
No. So the only time that you would incur penalties is if you stayed on that employer plan and it's not creditable. So if it's less than 20 employees, then go ahead and do sign up for Medicare, but you shouldn't incur any penalties. Another thing is when you turn 65, you cannot have Obamacare or Marketplace insurance or the individual plan. So yes, you can have them, but you're still going to incur those penalties. It doesn't matter how Cadillac of a plan it is.
Right, okay, that's good to know for sure. And I mean, have you found in your experience, are people working a little bit longer than they used to and facing these decisions?
You know, it's either I'm done.
Yeah.
I don't want to work anymore. Which can you blame them?
Sure, right.
Or it's you know, I'm going to keep working till I'm 70. It's such a mixed thing right now. You know, in terms of with employer coverage, if they have retiree coverage, then typically they do stay with that, because if you deny it, then you most likely can't get it back. So there's a lot of different things that go into that decision. And we are going to be covering this on the podcast.
Yeah, that's perfect.
So we're going to be going more in depth about the different scenarios and situations about working
so
after you're
many
65.
variables there. And, you know, on Medicare Mondays with Mackenzie, we do get to talk a little bit about it, and there's such great, fascinating conversations. But that podcast really is an opportunity just to dive a little bit deeper. So these are the things you'll be talking about in this coming podcast?
Yes. I'll be talking about this. And the podcast is called Medicare Matters with Mackenzie. And they're very short, maybe 20 minutes long, just to give you just enough information to where you know if you hear something else, then it's not true. So.
Yeah, that's right. Or give them a call. That's exactly right. Give you a little tidbit for sure. And one of my favorite parts of this segment, what do you charge for your services? And then how can somebody get in charge?
Nothing. So we are not allowed to charge contractually. And they can get in touch with me by calling or texting 512-599-9527. You can go to my website, premiermedicaresolutions.com, or you can send me an email at mackenzie@premiermedicaresolutions.com. You can also find me on social media and get the podcast wherever you find your podcast.
We love that. Make sure you tune in. They'll dive deep into that conversation this Friday. We'll get this posted on cbsaustin.com too. Make sure you can find her on social media. Always great conversations. Medicare Mondays with Mackenzie. Mackenzie, thank you for being here. We appreciate it.
It was good to see you again.
Well, good to see you, and we'll listen to you this week on your podcast.